As a team leader, I was delegated the responsibility to take part in the GP surveillance program, and I've been doing this for about 10 years. And I have a vested interest in making sure we do as much surveillance as we can, because we feel part of the National Health Team.
At the Broad Street Health Centre we became involved because rural communities are different. We have different types of people in our populations and we have different types of illnesses, and I think it's important that the rural populations are not left out of the national screening to see what are the illnesses that are around.
You're taking part in the World Health Organisation actually, formulating flu vaccines for future years, and you're serving as an early signal for whatever flu viruses are circulating in our community, and that's so important in a small country with limited health resources to get in early and get in quick.
Local results for us were sent through via an email newsletter, and it was a really good way to share with our team how our community was doing with those winter bugs. It didn't just show influenza, it showed RSV and rhinovirus and COVID, and it was a good way to see the trends of what was happening in our community at the time. And it did mean that we could tailor our education directly to what was relevant in our community at the time.
It serves as an early warning signal because if I can see that there's a lot of flu cases in the North Island, for example, or Auckland, due to our patient mobility, I know that that flu strain is going to come south pretty quickly. And as a team leader, that helps me formulate contingencies. So, for example, I might arrange extra clinics. Patients who participate in the ESR surveillance, I've found, are generally really happy to take part. I give them a brief explanation of what it involves, but also explain that this helps formulate the following year's flu vaccines, and also in the Northern Hemisphere.
We could notify patients what was their illness. We could then advise them targeted information about that illness and what to expect. So when we offered it to patients, nobody declined. Everyone that we offered the surveillance swab to accepted, and some of them were quite excited to get their result. It's not a result that you normally get if you're not part of a surveillance screening program.
Fitting in the ESR surveillance program into our normal workflow is pretty easy. I've already assessed and examined the patient, so really all I have to do is registering them as having flu-like symptoms which fit the criteria. The registration takes no more than 30 seconds, and taking the flu swab is maybe 2 to 3 minutes.
So the ILI form online was really easy to fill out.
The e-form is incredibly slick and quick.
It was very self-explanatory, and it opened up more boxes as you ticked, and I didn't have any trouble doing it, and neither did the nurses that were working within the team.
We set up the programs well ahead each year and do a lot of staff education about what the purpose is, how we're going to do it, and it's tailored to our practice. And so that the aim is that all the clinician has to do is take the swab and generate the lab form via HealthLink, which is so easy.
If you're not a part of the surveillance program already for this coming winter, I would definitely suggest that you become a part of it if the opportunity is available. The surveillance program was a good way to see what was our local issues, but also we were then part of a national surveillance screening to see what was the trends within New Zealand.
The end result is that you get good surveillance.